Hey everybody, I wanted to share with everyone today a story about myself. It's a very hard story to really admit to, and also how this healthcare plan, this government healthcare plan, is going to affect my family. Basically, a little history on myself. This is actually a really hard thing to admit to. Is in the late '90s, my wife and I were very poor people. In fact, you know, I would just say it was sheer poverty. Um, I personally went hungry several times in the late '90s, and there was many nights where I just would scoop more food over to my wife's plate with what little we had, so that she could eat. And the one thing during all that hardship that we went through that we never did was turn to the government for help. I never turned to my fellow man to provide food for myself. And even though we could have qualified easily for food stamps, and we could have qualified for probably even for welfare at that time. We never did. We're in a very awkward circumstance. Both of us were basically thrown out of our homes as teenagers, and it was just a very hard way to live. And we didn't have careers set out in front of us, and it was just very poor part-time jobs that we could carry, and it just left us in complete poverty. But anyway, my point is the whole time we never, ever even considered taking from the government. And during those times, we learned a lot about natural medicine and became, I guess, naturalists is the word for it. And so we don't give much credence to the conventional healthcare system. In fact, for myself, I have not been to a doctor my entire adult life. I'm 33 years old. Um, my wife, she's only been to the doctor through the birth of our 5 children. And if we could go back, we would probably just go ahead and have a midwife or something like that. But anyway, that's not the point. We keep, as far as insurance goes, we keep catastrophic insurance on everybody, which basically means if we need to go to a doctor, a regular conventional doctor, we need to pay cash ourselves. The catastrophic insurance doesn't cover that. However, if there's a major thing like a surgery that has to happen, then we're covered. And it's a cheap policy, and one that helps me greatly because I'm self-employed, and the premiums are awfully cheap if you're going to pay for most of your own doctor coverage. But now the federal government's about to pass their, whatever the heck their health care plan is now. All I know that's in this health care plan are two things. One is going to require people who do not have medical insurance to get health insurance. And the other thing is it's going to require people to have policies that's up to par with what the government thinks we should have. Now, that's going to affect my family severely because out of this, basically today, we're doing much better financially. And we live in Texas, and I guess our household income is about $58,000 a year, which is pretty, I guess, about an upper middle class income range in Texas. And with our lifestyles today, we have about 2,000 extra dollars a month. That's above and beyond all expenses and clothing, food, everything. All the bills, house bill, everything. Mortgage, taxes, insurance, everything. 2,000 extra dollars a month. And the federal government's going to come in and tell us our insurance policy isn't good enough. And me being self-employed, that means I'm going to have to run out and buy government type insurance, whatever is good enough for them, which would probably be a standard $1,000 deductible policy a month, maybe at an 80/20. And for my family, that's around $1,500 a month. So the government's going to come in and tell me that we have to pay for this medical insurance, which we would never even need, and lose all of our extra money, or nearly all of it, every single month. And this is a complete slap in the face, especially for somebody like me who struggled. I was going into periods of starvation, and I didn't take from my fellow American. And the government's going to come in here and take from us. And it really pisses me off, basically, because 3 days of my work week is spent earning the money for our bills and food and everything. Those 2 other days of the work week, Thursday and Friday, are spent making the extra money. The government's going to come in and slash that away from us. Now, here's the ironic part. If I quit working those 2 days, Thursday and Friday, and just decided to take it easy and watch Judge Judy or something all day, I don't know what people do, but if I took it easy those 2 days, then my family could qualify for Medicaid, because we would be within the income bracket with all the children that we have for Medicaid. So I have a choice. I can either have all the extra money I make taken away from us, all the money that we would spend going camping or on trips or something like that, just taken away from us, which would leave us just with basic food money and bill money and clothing money and that kind of stuff. Or I can just quit working those 2 days and get free health care. I'm not going to have the money anyway. That's the problem with government intervention. They need to back off. They need to leave us alone. We're already in the Great Recession, whatever the heck that means. We're in a depression, and everybody knows it. Almost every person over the age of 62 or older that I know retired because they had no work. I know families right now are giving away homemade Christmas gifts because they know that a lot of people can't afford them right now. This is an amazing time in our American history, and they're hurting hardworking people like my wife and myself, who basically brought ourselves out of hell, impoverished hell. It's not easy to go to bed hungry. I'm going to tell everybody that right now. And we worked our way out of it. We made good financial decisions. We kept ourselves out of debt, and we grew and grew my business. And now they're going to come and take it away. So I want everybody to give me what their opinion is, what I should do. Maybe I should just quit working those 2 days and say, screw the government. Let the government pay for it until the entitlement system crashes around them. And then they will realize that we couldn't afford this to begin with. So anyway, your input would be greatly valued. Thank you.